thought electric shocks is torture.
Torture.
I can't see how it possibly does any good whatsoever.
Mm-hmm.
Like, the brain is really delicate, it's just full of nerves and electric impulses, and you then are just putting a load of electricity through it in a very... Just noticed that I lost my sense of direction after having it, which is something, when you think about what can you say was definitely there before and not there afterwards, it's very subjective, but that was something that I used to have a very good sense of direction, and I don't know. I felt I had brain damage.
Yeah.
I wanted to die afterwards.
How many times did they give you?
Only 6.
6. Well, still a lot. I think 1 is a lot, but...
I felt 1. I think that must have been the first one. I have one memory of being pinned down, feeling that I was dying as they injected me and not going to survive, which in a way I did die to myself. I didn't find any benefit whatsoever. But
so they did it without you agreeing to it?
Oh, I wasn't capable of...
But they said you didn't
They
have
said
capacity.
They said I didn't have... Basically what happened was I went into hospital voluntarily because I was unable to eat and drink and I was feeling really ill. After I'd had the ECT, I had severe problems with memory. I couldn't even remember the Lord's Prayer, and there's days that I still can't do that. I still have difficulty going to sleep at night. I became rigid with tears falling down my face when I watched A Beautiful Mind. I went to the student counselling service when I got out of the psychiatric services, and I only managed to get out by refusing to say I was depressed when they were trying to get me to say that. And the psychiatrist asked if I wanted a second opinion. I knew he had a very high suicide rate because my sister worked in the morgue at the time. And I got referred to a different psychiatrist who asked me if I thought my treatment had helped me, and I said I didn't know, and he said it had probably made me worse. And being validated really helped. In my mind I reasoned it out that it was a brain injury, and if it had occurred through a stroke or something similar, I would be helped to recover. So there's been frustration there that I haven't had that help. But in my mind I told myself I had to put it behind me and get on with it, just as if it was a stroke. I was advised to sue by student counselling, but I felt that if I had to go forward and talk about it, I'd fall apart completely, dissociate, and maybe wouldn't even be able to keep going at all. After the ECT, I've had severe problems with suicidal thoughts and feelings, something that I never suffered from before the ECT. And it was only because my mother came back acting on an instinct that I didn't swallow all the tablets I'd been given, which were making me very ill. And when I tried to talk about coming off the tablets, I was told I could have an appointment in 3 months' time. So I rang back and said I wasn't prepared to wait 3 months. I was going to stop my tablets. I'd rather do it with their support than without. They found a cancellation. I saw somebody in 2 days. We had a chat, and the psychiatrist sat there and said, well, everybody's version of reality is different, and that was that. And I said, well, how do I get off the tablets? And it was like, well, just stop them then. And I don't accept the split between mind and body that is current in today's society. I think that when you break your leg, when you break your back, it's painful. Pain can make you delirious. Kidney infections can make you delirious. And this arbitrary split, especially where psychiatric nurses aren't trained now in medicine, so they really have very little understanding of pathological processes as far as I can understand. They don't seem to have understanding of boundaries. They seem to define their patients by the conditions rather than seeing them as people with a condition. And although doctors have told me things have moved on, the last time I went into mental health hospital, I saw what I would describe as very bad practice in terms of trying to get patients to think of themselves as substandard people rather than valuing them and respecting them, and that was quite shocking to see. The difficulty with all of this is, of course, money's tied up in it, and nobody wants to actually accept that the mental patient sitting in front of them is somebody exactly the same as them, just in a different part of their life. And I think things need to change, but it needs to be the whole of society that changes it. It's not going to work with just a few psychiatrists who are very diligent and very sensible. I was lucky enough to get a psychiatrist who'd been a surgeon before he became a psychiatrist, who was actually one of my lecturers, and he helped me recover. And I remember one psychiatrist saying just keep away from psychiatry and I'd be okay. However, losing memory means sometimes when you face a stressful situation, you behave in ways that you were trained to do, and electric shocks are a very strong form of training. I certainly thought I was being punished when I was in the mental hospital, and I would never have given consent to that treatment ever, not in a month of Sundays. I wouldn't want my worst enemy to go through it. And the reason I didn't sue was, one, I didn't want to take money away from the National Health Service. Two, I didn't think I would cope with headlines in the newspapers, which I imagine might have happened. And three, I wasn't happy that I would survive the experience of talking about it. And I felt I'd only just escaped with my life. I didn't really want to risk losing it again. And in fact, every time I feel that I am going to lose my marbles, it's really hard, or get back into that situation again, and even a small way, it's really hard not to feel panicky. And I thought of suicide as a positive thing that I could now do, because in that hospital I didn't even have the choice to do that. I couldn't even move, and I've never had any real support around recovering from that sense of helplessness, or the effects on my behaviour where I can get triggered by things that I have no idea about what caused it. I lost my memories, and I have been recovering some memories after a lot of therapy, and that's a very painful process. It's like you feel like a second-class citizen afterwards. It's like a branding but in your brain, and as soon as people see you've had ECT in your medical notes, they don't treat you properly. I said to one psychologist that I felt the ECT had damaged my brain, and she just said, "Oh no, I don't think so." So she just discounted my experience and said she didn't think so, and I just turned and I said, "Why? How do you know? Have you had it?" And the answer came back, "Oh no, I haven't, but I know a lot of people who have. No, it doesn't do any harm at all." And with that, I kind of jumped out of my skin, is the best way to describe it. And even though I was fully grown up, I couldn't handle it, and I did something that I would now recognise as some kind of fight or flight reaction, or confounding, and I stuck my fingers in my ears and wiggled them out, and stuck my tongue out, ran out the building, sat in my car and cried, and just told myself to be careful or I might end up sectioned. And the whole experience of ECT, for one thing, I didn't know what was happening. I was pinned down and injected, thinking I was going to lose my life. It was done against the advice of one psychiatrist who had gone home on leave weekend, and the other psychiatrist who was there got another person to sign consent. I would describe it as totally traumatising and of no use whatsoever. It just complicates the issue, and it's very hard to prove afterwards, because in my case I was given heavy drugs, I was given ECT. After the ECT I spiked a temperature of 106 and became very ill indeed and nearly lost my life, and I'm fully sure that was because of the effect of the ECT and the effect it had on the blood-brain barrier. I can't see any logical, useful way that it works, and additionally to that there's lots of evidence that shows that placebo effect can have an effect, and that, yeah, I've met 2 people who say it helped them, but a lot of people who say have experienced things similar to what I've experienced. I've also found that I quite often wake up at night sweated up. I also feel that I can't move sometimes. I felt the ECT the first time, and I'm convinced they had me light on anaesthetic, at least I think it was the first time, and it felt like being arching back inside as hard as I could go. It was just the worst thing ever that's happened to me. And if childbirth is on a scale of 1 to 10 and ECT is on a scale of 1 to 10, childbirth is a 1 and ECT is a 20. I just think it should be banned. It's torture as far as I'm concerned, and anybody who thinks that putting a load of electricity through somebody's brain in such an uncontrolled way could have any possible beneficial effects needs their head examining. Who am I? What is this thing called ECT that has taken away some essence of me? A cure-all, a magic, a sledgehammer nut, zapped your brain cells and crack as they zap. Now, no thoughts, just a blankness, a blot of black ink. where the thoughts can drop in and not come out. In the centre of your head somewhere, mid-eye, mid-brain, barbaric and cruel. Should have gone out long ago in someone else's rule. But still, I'm here and fighting and fit. Not quite all me now, as I'm missing a bit. The thoughts drop in and get lost in the void. The crisscross of wires that should keep me connected. The memories disjointed. A knitting undone, one loose stitch in the sweater garment is gone. But it's not knit one, purl one. Not as simple as that. It's a complex of gossamer, life form's own web. The spider has spun now in axonal threads. Your memories distorted, emotions misplaced. Oh, woe to this difference. Say goodbye to you. You are who you are, but you don't feel it so. You constantly thresh in attempts to remember the dismembered bits, and to heal and move forward, to rationalise and come to terms with what's been done, that you never asked for, were helpless to resist, and now must live onwards with you that you miss.